Hi, I'm Gina Ventola, practice manager for Ventola Law. One of the best parts of my job is meeting with business owners. However, at times, it can be difficult to meet in person. That's why I started this show, to introduce you to local business owners in our community. Join me on Your Virtual Coffee, a new kind of networking. Hey everyone, welcome to Your Virtual Coffee, the web show which introduces you to great local businesses in the Denver metro area. Today, my guest is Dr. Kari Chappell. My introduction says she is a physical therapist, but I'm going to tell you, she is the physical therapist to talk to. And she is with T-Zero Physio, a non-surgical orthopedic rehab and sports performance clinic. Dr. Kari helps busy patients overcome injuries, aches, pains, so they can take full advantage of their time and activities away from the office without injections, surgeries, or frequent trips to the doctor. She finds that in most patients, their sport or exercise of choice is much more than just a way to get fit. It is their community, their mental release, and the thing that makes them feel more confident of themselves. That is why she loves what she does. Dr. Kari understands that the feeling of devastation and gets to be an active participant in helping people get back to their sport, their community, and living the life they love. And with that introduction and a little disclaimer, Dr. Kari treated me for knee pain, which I will tell you, I've had no knee pain since we finished our work together.
Ooh.
So I can tell you, she knows her stuff. And with that, Dr. Kari, welcome to my show.
Hey, Gina, thank you so much. Thank you for that wonderful introduction, and I'm happy to be here.
Dr. Kari, we tend to like to do business with people that we like and know and trust. So I'd like for our audience to kind of get to know you a little bit. So what are your hobbies?
Let's see, I like a lot of different things, mostly outdoor stuff, for sure. One of the reasons why I wanted to live in Colorado was for the mountains and for skiing in the winter, for hiking in the summer, camping, all that kind of fun stuff. I also love playing soccer. I usually play on a team every week, and volleyball. Those are probably my two main kind of sports, a little bit of tennis, and then I also love food. I love to travel. I like to eat good food, which makes me learn how to make good food. And yeah, those are probably my main hobbies.
Now, speaking of food, do you have a favorite cuisine? And if so, what is it?
Ooh, I don't know if I have a favorite cuisine. That's a good question. If I had to eat like one thing for every meal, it'd probably just be tacos, honestly. You can do a lot of different things with tacos that can make them delicious. I don't think I'll ever get sick of them. For favorite cuisines, I honestly just like to try a lot of different things. One of the reasons that I love traveling is just trying out different foods too. So I always take a lot of joy from that.
How did you decide to come into the world of physical therapy?
Yeah, I played a lot of sports growing up. Soccer was my main sport growing up and throughout high school. And so I think kind of my first main introduction to it was having a pretty good injury during high school soccer. So I tore my quad muscle. It was kind of like a random fluke thing. I didn't warm up good enough during a practice and kicked a ball and irritated it, and then just, never took the time to figure out rehab or go anywhere. I just wanted to keep playing, so it kept kind of injuring it more throughout the season. So I think that was kind of my first introduction to it, and really understanding like how injury affects people. So kind of as you said in that introduction, without being able to play soccer for a little bit, I lost my community of soccer players. I had to sit out from something that I really loved, and it was much more than just like playing soccer. It was the people, it was everything else that goes along with it. So I think that kind of started up my like passion for wanting to get people back into their sport or exercise of choice. And then I think later in college, I wasn't playing sports anymore. So I tried running a half marathon, just to something to challenge me. And I had terrible knee pain the whole time. And I was 20 years old, you know, and I got so sick of it. And I just kind of like started believing the lie that I just wasn't a runner. I'd never learn how to run without having pain. And I ended up doing like a long run with my dad a few weeks before my half marathon, and he was fine, and I had terrible knee pain, and I was like, oh, this is the worst. So I started to hate running at that point, and then it actually kind of interested me in what's going on with knee pain. Started doing all this research in college, kind of part of one of my classes, and then now as I've learned a lot more about how the body works and how different forms of running and different movements you can adjust, and strength gains and all this different stuff you can do, that I don't ever have knee pain when I run anymore. So that kind of gave me this new vision of like how often people, including myself, buy into this lie of I'm just not a runner. I can't do it. It hurts. I'm not built to run. You know, I was just kind of told by like doctors and stuff that running's not good for you. And then I totally started to see the flip side of that is if you do it well, and if you learn how to move well, and if you learn how to have proper strength and control to take in the impact that running is, then you can totally do it without knee pain. So now that kind of fired up some more passion in me of fighting these negative opinions that we can get from medical professionals or from culture or whatever it might be, that we can't do something, when maybe if you have somebody else look at it a different way and adjust it a different way, that there is something that you can do about it. So that can bring a lot more joy into people's life, and to be able to do something they love again without having to have pain during it.
Well, I like how you mentioned how other doctors and stuff were kind of giving you more negative news, like, you know, maybe you should pick a new sport. Because I'm sure a lot of our viewers deal with that and hear that. I know I've heard it because I have an old ACL injury where I was told, yeah, maybe running's not your sport. And as you and I found out, that's totally not true.
Yeah.
So with that being said, what makes T-Zero Physio special or different than other physical therapy places?
Yeah, so Dr. Kevin DeGroat is the one who started T-Zero Physio about 4 years ago, and I went to school with him at Regis University, so got to know him there. And then I kept in touch with him after school and kind of saw what he was doing with starting this company, and kept reaching out, asking him questions, and then eventually joining up with him. And I think some of the biggest things, so I was working at a pretty classic orthopedic clinic for my first 3 years out of school, and then started here after that. And so in a classic orthopedic clinic, the whole system is set up not according to what the patient, what the client's needs are, you know, and you can look at it and it's like, it's totally flipped. So a person might need just to talk to a doctor, to spend good time with a doctor. They might need to spend some time with a physical therapist, and they might need, you know, a lot of people have different needs for what they're coming in for. But the system isn't set up for that. It's set up for what insurance will pay for, what insurance will look at. It's set up for how much time a doctor has in their schedule, which is usually 10 minutes, 15 minutes. Not many people get much more than that of time with talking to a doctor. And then when they come to physical therapy, you usually spend an hour with somebody, or you have them in there for an hour, but you're overlapping people all the time. So I would really only have 20 minutes of one-on-one time with a person, and then the other 20 minutes on either end would be overlapped with another person in the clinic. So I'm constantly telling two people to do two different things, and in a lot of cases it worked out fine, but in people who didn't want surgery, who had higher goals, who really wanted to understand what was going on, those are the people that I really love to work with. But I found myself being frustrated that I didn't have enough time to work well with them, or to help talk through them, or to even get enough hands-on time with them, or to spend enough time to making sure they're moving well, all the things that can help them. So I'd be really frustrated where sometimes I would be just kind of bored with the way things are set up, and sometimes I would just want to do more for a person and be excited with the person I'm working with, but not be able to. So that whole kind of traditional medical system isn't set up for priorities of the patient or for the client. It's totally set up for what insurance will cover and what you have to do in a schedule. So we kind of took insurance out of the game here, which allowed us to flip that whole system on its head. So now we can schedule people however they need to be scheduled. We're just by appointment only. So I have done a 7 or 8 p.m. visit before. I've done a 6 a.m. visit before, whatever works. And then we always do our first visit. We keep our first visit really cheap, and that we spend a good hour with somebody. And so that the goal of that is that anyone should be able to talk to a medical professional and get really good advice and be able to answer all their questions and just talk about something and look at everything from a whole body perspective, and then get a good idea from there. So the other thing about the way the traditional medical system is set up is that if you come into me with knee pain, I can really only look at your knee. If I start treating your back or anything else, that's almost a flag for insurance where they don't want to cover stuff like that because I'm supposed to be treating your knee. But that totally doesn't work in the real world. So our first session is always, let's look at how you walk. Let's look at how you squat. Let's look at how you balance. Let's look at how you run, whatever it is. Let's look at how you move your arms, or let's look at just how you stand. And that's our whole first session. So we're just looking at everything together, how your body works together. We spend an hour is a lot of time to spend with a person. And oftentimes we run beyond that if we have time in our schedule, just so we can spend the time it needs to talk through everything, to get a full understanding. I'm showing my anatomy app to people all the time because people like understanding their own body and understanding what's going on. So I think that's really what we're passionate about, is let's set it up to have success with a person and to be able to meet your needs in however you need them met, rather than only what insurance is going to cover, only what our schedules allow for, only what all the other restrictions might be in a normal medical setting.
It sounds like you put the emphasis on the patient and what the patient's needs are versus running a business, which I think is great, because that's kind of why we're all in business, is to help people.
Yeah.
What would be one thing that you would like potential clients to know?
I think that main thing would be that I think what a lot of people don't realize is that there are other options out there. And I think that's the most exciting thing about what we can do, is that most of the people that we see here are people who have tried everything else already. So they come in a little bit skeptical. They've been told different opinions. They've been told they might need surgery, but they don't like that idea. So those are kind of where we thrive, where people have heard that they need something more intense, or they're worried that they need something more invasive, but they like the idea of not needing that. And so we're kind of that voice of, hey, there might be something out there, like, give us a shot, let us take a look at you, let us try to give a second opinion, show you what we can do. But yeah, I think that's the main thing that we like people to know, is that if you've only heard stuff that you don't want to hear from a medical professional, or if you're scared to go into a doctor because you're afraid of what they're going to say, there's other options out there. And we're always fighting. We don't recommend surgery for the most part. We usually think there's another way around it. We usually don't even recommend rest, like pure rest. It kind of depends on what's going on. There's a couple of things that you might need pure rest for. We don't put people in braces or boots or anything like that. So a lot of people are always afraid to go to the doctor because they're afraid of being put in a boot, being put in a brace, being told to rest, or being told they need surgery or injection. So we're totally on the opposite side of that. So if you don't want to hear that, or if you're afraid to hear that, come talk to us, and we'll be able to give you kind of what we think will work, which isn't going to be probably what you would think you would normally hear when you go see a medical professional.
Now, Dr. Kari, let's talk about power partners. Now, for our audience, power partners are those businesses who target our same ideal client, but are not our competition. A great example would be a real estate person and a mortgage broker, because they both target that potential homeowner, but they don't compete with each other. So with that being said, let's kind of get an idea of who your ideal client is. So who would that be?
Sure. I'd say our ideal client is kind of like what I had mentioned before, but somebody who has some goals that they have in mind, whether it's taking care of grandkids without pain, taking care of their own kids, walking, yoga, or if it's more like running a marathon or, sprinting faster at their Orange Theory workout, or rowing harder at their Orange Theory workout, or being able to lift a heavier weight. Whatever the goal may be, there's something that they want to do, and there's something that's limiting them, whether it's pain or just not being able to move well through the motion, or after they run for 3 miles, they start getting pain and they want to run longer than that. Whatever it is, some sort of goal that they're wanting to, and they're not sure what's holding them back or why they're getting some sort of pain. And that same person doesn't want surgery, doesn't want injections, doesn't want rest, has, especially people who have been told by a doctor, you're too old to do this, you're overweight, you have to lose weight before you can do this, you shouldn't do this anymore, this is bad for you, you'll never run again, or all that kind of stuff. Those are the people that we like, because they already have been told that they can't do something, and they don't want to hear that. So they are even more motivated at that point to want to do the thing that the doctor told them they can't do. So that's our perfect person, is somebody who has some sort of goals, has something that they want to do, even if it sounds, sometimes people think it like, I'm afraid to say this because it sounds crazy, but this is what I want to do. And we're all about that. We're like, yes, let's do it. Let's get you there. Let's do this. You shouldn't have to have pain when you're doing this. There's ways around it. We want to help you get there. And so that's definitely our perfect person. And it's always, I think one of my favorite things is like, I had a quote from a lady once that I was like, okay, I think we were 4 or 5 sessions in or whatever. And I'm like, okay, what percentage better do you think you are? And she's like, well, I don't really know anymore, because now my potential is so much higher than I ever thought it was before. So I don't even know what percentage I'm at anymore. And I'm like, that's amazing. Like, that's the best thing that you could possibly say, is that now you see so much more in your life, so much brighter futures or higher goals or whatever it may be. So yeah, those are the people we love to work with.
I love that so much, because the possibilities are just endless.
Yeah.
I mean, I can speak for myself personally, to be able to run and not experience pain or not have an achy knee in the evening after I've run or something like that is incredibly rewarding and fulfilling. And then you start thinking, okay, well, I did 6 miles today. Maybe I should train for a half marathon, because I just did a 10K. And so I totally agree.
Yeah.
So with that being said, so who else targets this client? What I'm hearing are people who want to feel better and take better care of themselves and be active. Would that be pretty?
Yeah, 100%. Yeah, for sure.
So I'm thinking good power partners for you would be people like nutrition coaches, nutritionists or registered dietitians, personal trainers would probably be pretty good for you. So any of you guys who are out there who are watching this, who do that, call Dr. Kari. You guys, see what you can refer back and forth. I found Dr. Kari through a referral from my nutrition coach.
Yeah.
So I'm telling you, it's possible.
Yeah, for sure.
What is the best way for people to reach out to you?
You can look at our website, T-Zero Physio.com. We have a lot of resources on there, which are really fun for people to look through, videos, downloadable stuff. And then there's like scheduling options on there. A lot of times for people who are curious but not really sure what they're looking for, we like to schedule, we have on our website for scheduling stuff an introductory call. And so we set aside a half an hour if somebody schedules that with us, and we'll hop on the phone with you. What questions do you have? What can we, what are you kind of wondering about? What are you curious about? So that's always a great first step, is like, you're curious, but you're not quite confident. What are you wondering about? So let's hop on the phone, talk about it. We also do just like a consult, we're calling it right now. So like an introductory session, spend an hour. You can just book one of those on our website. And so that's more of, we'll do our whole evaluation with you in that first session. Look at your gait, look at your squat, look at how you move, all that kind of stuff, functional, foundational movements. You can just reach out to us over email. Our emails are on the website too. Mine's just Kari, Kari, @T-Zero Physio.com. And you can find us on Facebook too. We have a business page, T-Zero Physio, Instagram, and then I run a Facebook group called Stay Healthy OTF. That's more for Orange Theory people. I've had some good connections through Orange Theory gyms. So I run that. Kevin runs a Try for Health, TRI for Health, for a lot of triathlete specific stuff. So there's a lot of different ways you can find us, kind of see some of the stuff that we're doing online or on our website. Or just reach out to us directly, and we're always happy to hop on for a phone call or to get you in person and kind of give you what our assessment is of what's going on.
I love that. And we'll include slides that have all this information, so we don't have to remember all this stuff.
Yeah.
Dr. Kari, thank you so much for coming on my show today. This is so helpful. I love the Facebook group ideas. I wanted to ask really quickly, do you have to be an Orange Theory fitness person to be in your Facebook group?
No, we have questions when you're trying to join the group. Are you an Orange Theory member? Are you an Orange Theory coach? And it's totally fine if you're not. All of this stuff is still going to apply to you. We just more talk about some specifics that go into Orange Theory, like rowing, like running, use some Orange Theory language like a push pace or a base pace or an all out or whatever. So some of that might not quite make sense, but most of the stuff is just injury information. We're mostly letting people ask questions. We make a lot of videos to address people's questions. I've made a ton of videos on how to do different exercises properly and things you might want to adjust if you're having some sort of knee pain with a squat or whatever it may be. So you can definitely join those groups. It's a good way just to kind of see what's out there and what we might be saying to people for injury questions, as for physical therapy help that we can help with. So that's a great way to connect with us and just to kind of see what's out there for sure.
Plus, I'm thinking that your advice is probably a little more accurate than maybe stuff we would find on Pinterest.
Yeah.
Or things like that. Because with what little I know, sometimes I see things and it's like, oh, maybe not.
I know. And that's actually what led us to starting these kind of groups, because I was in all these other Orange Theory groups when I started going to work out at Orange Theory, and it was a little bit painful to my soul to hear these things that when people are like, oh, I have knee pain with running, what have you guys done? And other people are commenting like, oh, don't run, or you need to go get surgery, or you should be really afraid, or just like all these crazy people are just diagnosing people all the time on Facebook after one comment, or telling people to be afraid. And I'm like, no, don't be afraid. You don't need surgery. Like, there's so much we can do. So we love being the voice of like, let's ask better questions. We don't need to jump to a diagnosis. We want to ask questions. We want to get a full picture of what's going on before we're going to jump into anything. And usually the conservative route is all you need for most people. There's definitely reason to get surgery. There's definitely reason to get injections. There's reason to get all that kind of stuff. But why not consider the conservative route first and let us help you do that? So that's definitely more our route of dealing with injury questions.
Definitely. I love that. Well, Dr. Kari, thank you for coming on my show today.
Yes, thanks so much, Gina. It's been awesome.
Audience, thank you so much for watching. We could not do this show without you. Thank you for watching. Be sure to subscribe to our YouTube channel. And business owners, let's have a conversation. Your virtual coffee is sponsored by Ventola Law. Ventola Law, mediation and legal representation at an expert level. You can find them at ventolalaw.com. Thanks for joining me today. For more information on Your Virtual Coffee, check us out on Facebook, Instagram, Twitter, and wait for it, our website at yourvirtualcoffee.com. Thanks again for watching and have an incredible day.